Hey everyone, welcome back to the channel. Did you know that 1 in 3 people will get cancer in their lifetime? But don't worry, here's the good news. Catching it early can make a huge difference. In fact, if you spot cancer in its early stages, the survival rate for many types is over 90%. So today, I'm sharing 8 early signs of cancer you should never ignore. These are small changes in your body that many people miss, but they could save your life. Let's jump in. Sign 1. Persistent heartburn. Let's talk about something we've all probably dealt with. Heartburn. That burning feeling in your chest or throat, usually after eating spicy food, fried food, or drinking alcohol. Most of the time, it's harmless and can be fixed with simple changes or antacids. But when should you worry? If your heartburn sticks around, even after meds, or keeps coming back over time, it could be a warning sign. Esophageal cancer often starts with these subtle symptoms. Other signs to watch for. Trouble swallowing. If food or liquids hurt to swallow, it could mean something's wrong with your esophagus. Food getting stuck. If you feel like food's not going down smoothly, that's a red flag. Unexplained weight loss. Losing weight without trying? It might be linked to something serious, like cancer. Why does this happen? Chronic heartburn can be caused by GERD, where stomach acid backs up into your esophagus. This can lead to damage and, in some cases, a condition called Barrett's esophagus, which can eventually turn into cancer. What you can do: lifestyle changes. Don't eat 2 to 3 hours before bed. Cut back on spicy, greasy, and acidic foods. Stay at a healthy weight. Talk to your doctor. If heartburn is a regular thing, or if you have any of the other symptoms, don't ignore it. Ask your doctor about getting an endoscopy to check for early damage. Heartburn may seem minor, but if it keeps coming back, it could be your body's way of asking for help. Early detection is key. Don't wait. A simple checkup could save your life. Sign 2. Unexplained night sweats. We all sweat at night, especially when it's hot or if your room's stuffy. But if you wake up soaking wet every night, needing to change your clothes and bed sheets, it might be more than just the weather. When should you worry? If you're dealing with persistent, heavy night sweats, it could be a sign of lymphoma, a cancer that affects the lymphatic system, the part of your body that helps protect you from infections. Other symptoms to look out for: persistent fever, a low-grade fever that just won't go away. Unexplained weight loss, losing weight without trying. Extreme fatigue, feeling tired all the time, even after a full night's sleep. Why does lymphoma cause night sweats? It's your body's way of trying to fight off cancer. When cancer cells are present, your immune system kicks into overdrive, causing unusual responses like fluctuating body temperature, which leads to those excessive sweats. But night sweats don't always mean cancer. Other causes can include infections, things like tuberculosis or HIV, hormonal imbalances, conditions like menopause or hyperthyroidism, medications. Some drugs like antidepressants can cause night sweats. When should you see a doctor? If your night sweats come with fever, weight loss, or constant exhaustion, don't wait. Talk to your doctor. Early detection can help pinpoint the cause and get you the right treatment. A simple test, like blood work or a biopsy, could make all the difference. Your body is trying to tell you something. Don't ignore it. Acting early could save your life. Sign 3. Jaundice. Have you noticed your skin or the whites of your eyes turning yellow? This could be jaundice, a sign that your liver or bile ducts aren't working properly. While it can be caused by things like gallstones or hepatitis, it could also be an early warning of more serious issues like pancreatic or liver cancer. Other symptoms to watch out for: dark urine, brown or tea-colored urine, pale stools, stools that are white or gray, upper abdominal pain, especially pain on the upper right side near your liver, itchy skin, a less obvious symptom caused by a buildup of bilirubin. What causes jaundice? It can be from harmless conditions, such as gallstones. They can block bile ducts and lead to jaundice. Hepatitis, either viral or alcohol-related, it affects liver function. But it can also be linked to serious conditions like pancreatic cancer. This often blocks bile ducts due to the pancreas's position. Liver cancer, it impairs liver function, leading to jaundice. Gallbladder or bile duct cancer. Tumors can block bile flow. What you can do: limit alcohol. Too much alcohol can damage the liver. Eat a healthy diet. A diet rich in fruits and vegetables supports liver health. Get regular checkups, especially if you have a family history of liver disease or smoke. If you notice signs of jaundice, don't wait. It could signal serious issues like pancreatic or liver cancer. Act early. A checkup can lead to earlier diagnosis and better outcomes. Your body is speaking to you. Listen to it and protect your health. Sign 4. Persistent bone pain. Bone pain is something many of us experience, especially as we get older or after intense activity. But if your bone pain doesn't go away and gets worse, especially at night, this isn't normal. It could be a warning sign of bone cancer, osteosarcoma, or cancer that has spread to the bones. Signs to watch for. Swelling. The painful area might swell or get red, especially near joints. Unusual fractures. A bone breaking from a small impact or for no clear reason might mean weakened bones. Pain not relieved by medication. If painkillers aren't helping, it's a red flag. Heavy sensation. The pain may feel like pressure on the bone, especially at night or when resting. What could cause persistent bone pain? Primary bone cancer, osteosarcoma, a rare cancer that starts in the bones, most often affecting children and young adults. Metastatic cancer. Cancers like breast, lung, or prostate cancer can spread to the bones, causing pain. Other conditions. Osteoporosis weakens bones, causing pain and fractures. Bone infection, osteomyelitis, a serious infection that spreads to the bones. How to protect your bones. Exercise regularly. Weight-bearing exercises like walking and jogging strengthen bones. Manage your weight. Reducing stress on weight-bearing joints helps protect bones. Don't ignore symptoms. If you experience persistent pain, get checked early for peace of mind. Why does bone pain get worse at night? At night, your body is resting, and pain signals from damaged or inflamed bones are more noticeable. This is when the body focuses on healing, making the pain worse. Persistent bone pain can be a serious sign of an underlying condition. If you notice these symptoms, don't wait to seek medical advice. Early detection can improve your treatment options and quality of life. Sign 5. Unusual skin changes. Most rashes are harmless and caused by allergies or the environment, but some skin changes can be early signs of serious health issues like leukemia. Signs to watch for. Petechia, subcutaneous bleeding, small red or purple spots under the skin. These spots don't fade when you press on them. Unexplained bruising, bruises that appear easily even without injury, especially in unusual areas like your arms or legs. Abnormal bleeding, frequent nosebleeds, bleeding gums, or heavy menstrual periods. Dry skin or itching. The skin becomes dry and itchy, a sign that leukemia may be affecting the immune system. Why skin changes can signal health problems. Your skin reflects the health of your circulatory system. When your body struggles to produce healthy blood cells, it can lead to problems like petechiae, bruising, and abnormal bleeding. Leukemia is a blood cancer where the bone marrow makes too many abnormal white blood cells, which affects red blood cells and platelets. Other symptoms to watch for. Fatigue, feeling tired all the time, even when you get enough rest. Fever or frequent infections, a weakened immune system makes you more prone to illness. Unexplained weight loss, losing weight without changing your diet or exercise. Your skin is like a mirror for your internal health. If you notice unusual changes like petechiae or unexplained bruising, don't ignore them. Early consultation with a doctor can help catch serious conditions like leukemia in time, giving you the best chance for treatment. Listen to your body and act now. Sign 6. Persistent fever. A fever is usually your body's way of fighting off an infection. But if a fever lasts for weeks or keeps coming back without an obvious cause, it could signal something more serious, like blood cancers such as leukemia or lymphoma. When should a fever raise concern? A fever becomes a concern if it lasts more than 2 weeks or keeps coming back without symptoms like the flu. Here are some things to watch for. Fluctuating fever. The temperature rises and falls irregularly, or it happens at certain times of the day. No response to medication. Fever reducers or antibiotics don't help lower the fever. Other symptoms. Weight loss, fatigue, night sweats, or swollen lymph nodes may accompany the fever. Why do blood cancers cause fever? Fever is your body's response to fight off abnormal cells, like cancer cells. In leukemia and lymphoma, the immune system is weakened, and cancer cell growth can cause inflammation, leading to persistent fever. Tips to protect your health. Regular checkups. The best way to detect serious conditions early is through routine health checks. Healthy lifestyle. Eat well, exercise, and maintain a balanced diet to keep your immune system strong. Listen to your body. Pay attention to any unusual symptoms, especially if they last. If your fever lasts more than 2 weeks without a clear cause, don't ignore it. Get checked by a doctor to catch any serious conditions early. Early detection is key to better treatment and a higher chance of recovery. Your body knows when something's wrong, so trust it. Sign 7. Changes in fingernails. Your fingernails do more than protect your fingertips, they reflect your overall health. Unusual changes in your nails can sometimes point to serious issues, like subungual melanoma, a rare but dangerous type of skin cancer. Watch for these nail changes. Dark streaks under the nail. A black or brown streak from the base to the tip that doesn't fade or grows over time could signal melanoma. Spreading pigmentation. If the color under the nail spreads to the surrounding skin, it's known as Hutchinson's sign, a warning sign for melanoma. Brittle or deformed nails. Subungual melanoma can cause nails to become thick, brittle, or misshapen. Pain or swelling. If you notice pain or swelling around the nail without an obvious cause, it's worth checking out. What causes subungual melanoma? UV exposure. While less common than skin melanoma, UV radiation can contribute to subungual melanoma. Nail trauma. An injury to the nail may trigger the formation of cancerous cells. Genetics. A family history of melanoma can increase your risk. Your nails can be an early warning system for melanoma. A dark streak or other changes should not be ignored. If you notice anything unusual, consult a doctor as soon as possible. Early detection can lead to better treatment outcomes. Sign 8. Persistent eye pain. Let's talk about your eyes. They're not just the windows to your soul, but also a reflection of your overall health. Persistent eye pain, blurry vision, or dark spots on the iris could point to ocular melanoma, a rare but serious eye cancer that needs early detection. What to watch for? Eye pain or discomfort. A dull pain or pressure without a clear cause. Blurry or distorted vision. You might see things out of focus or experience flashes of light. Dark spots on the iris, any new brown or black spot on your iris. Uneven pupil size. If one pupil reacts differently to light, or if it's unusually large or small. Peripheral vision loss. Feeling like you're looking through a tunnel rather than seeing clearly around you. Why does ocular melanoma happen? Ocular melanoma forms in the pigment cells, melanocytes, in parts of the eye. We're not exactly sure why it happens, but there are a few factors that could raise your risk. Light-colored eyes. If you have blue or gray eyes, your chances are higher. Sun exposure. Long-term UV exposure could damage the eyes. Family history. If ocular melanoma runs in your family, you might be at greater risk. Your eyes give you a lot of clues about your health, so don't ignore signs like eye pain, dark spots, or vision changes. Early detection is key. Look after your eyes, and they'll help look after you. Your body is always talking to you. The key is to listen. These signs may seem small, but they can save your life if caught early. If you've noticed any of these symptoms, don't hesitate to consult a doctor. Remember, early detection leads to better outcomes. If you found this video helpful, give it a thumbs up, share it with someone you care about, and subscribe for more health tips. Your support helps us spread awareness and empower more people to live healthier lives. Thanks for watching, and take care of yourself. You deserve it.